So we're at IABA. Does the I stand for something?
Individualized applied
Awesome.
behavior analysis.
I love it. So how is IABA different from other centers?
Well, we still follow the core principles of applied behavior analysis. We try to implement evidence-based practices that have been shown to be effective for children on the spectrum in different contexts. The main part that I sort of focused on when we came up with this idea of like individualized applied behavior analysis, what does that mean?
Mm-hmm.
It just meant that what we wanted to do was come up with a more personalized approach to picking the programs that we have for a kid and not just choosing programs from an assessment like the VB-MAP or the ABLES simply because it's the next one.
Yes.
So it may be the next program if we're on, B3 and we say the next one is B4, but we need a rationale besides that B3 was the last one to run that program. So what I wanted to avoid in IABA and in the programming was simply arbitrarily choosing goals that didn't relate to new behavioral cusps or new ways that we could get a client to learn how to do something that might actually generalize to the regular world without us having to sort of just say, well, again, we were on B3, so now it's B4. But if B4 has a rationale for later on for that child, then it's something we really need. And both of those assessments are awesome assessments. They guide our treatment planning a lot, and they help us recognize progress. However, it's not the only justification that we use, and we also use other assessments, and we come up with sometimes just programs with our own place. So I'd say that's one area of, I guess, how it's different and what's individualized about it.
That's neat. So when your staff are using the assessments, when you first hire people, do you run into any issues with people being able to come up with those rationales? Like, has that been a hard thing to train or get people to do initially?
Yeah, I mean, it's a good question. It's been sort of a process where some of the BCBAs here have actually been with me for their practicum experience.
Okay,
and so
nice.
they've been here for 1,500 hours,
Right.
with usually a lot of supervision. Typically exceed the supervision requirements by like 2-3 fold.
Yeah.
So some of those BCBAs that have become BCBAs in this system that have worked with me for 4 or 5 years, they're right on board with this idea, and it's been a part of their training. If we hire in or we have BCBAs who have not really done that before, most BCBAs that have had some center-based experience, they sort of already know this. It's not that people just come in sort of pre-taught that you always just run the next step. It's just the process has been sort of, yes, that may be a good program. Tell me about, like, see the end goal and not just the program. How does mastering whatever that skill is, so like much like what we saw in the circle times today, group attending, being able to attend to an instructor is a good goal in a group. Why?
Right.
Because you want to be able to then have various instructions being given so that the student will attend. Motor imitation. We teach motor imitation lots of ways, and it's in every standardized kind of assessment, or standard assessment, but not really standardized. Nonetheless, we always teach motor imitation, and we teach these targets like clapping and patting and doing all sorts of various lists of motor imitation. So once you teach that in a DTT setting, what do you do with it?
Right.
And so many people are aware already that generalization is a component that should be programmed in, and we sort of think of, what's this kid going to do when they leave here? They're liable, most of our kids are early intervention or going back to school. So we need them to be able to use that motor imitation in a group format and follow along, and not just in a DTT format.
Right.
So it's largely related to the generalization piece and trying to figure out, what are they going to do with these skills when we teach them? Not just to get them on a DTT card, run trials, get a percentage or a probe that says it's mastered, and then like you never see it again.
Right. Yeah. One of my friends, Amy Evans, she works for Chartlytics and is really into precision teaching. And I went out to see her in Denver, and it was really, she's just been flabbergasted because she does a lot of coaching now with her job, and there's so many people that she's having to tell how to think about that stuff, because it's really built into precision teaching. When you design your programs, in your program you have a section where you talk about the application and how your testing for your mastery is seeing it in application, right? It's not just an 80% and then it's done.
Right.
So she was really surprised to see that a lot of people, and it's same, like I have the same issue until I had experience with precision teaching as well. any of my training for in-home ABA services was always like, you know, three sessions in a row at 80% or whatever, and then it's mastered and it can go in the maintenance binder or whatever.
Right.
But there was never any sort of application check to see it, you know, in real life, or any like, you know, larger meta-analyses done or anything like that. So, you know, see what's actually happening in real life for this child.
Yeah.
So that's awesome to hear that that's a huge focus for you all here.
Yeah, another big focus that we've tried to incorporate is school-based routine and school-based types of programming. There's sort of like benefits and drawbacks about programming like this. One thing that I've sort of noticed over the years, and I wanted to try to really address at IABA, was that when you train predominantly in a one-on-one DTT setting with very immediate reinforcers and tight control, you get really good acquisition. And so when you move to looser instructional settings, you're somewhat sacrificing some of the potential acquisition or how fast kids might learn things, but you're trying to get them to learn in a less structured environment, which is what the real world is going to be like if they can discharge from a place like this. Not all kids are on that track. We do have kids that are not really having goals right now to do a circle time with lots of various instruction and learning. And I'm not convinced that seeing a word or a sight word in circle time equates to you mastering that word and being able to read it in the future.
Right.
We have programs for that on the side. But being able to sit and participate and get that exposure to the different types of learning may or may not be an effective way for a child to acquire a skill. And for us, the idea is that a natural, not ABA method, or what we kind of contrive often in our programming? What does that look like in the real world? But it doesn't mean all kids can get there. And I think that that's a really important distinction in individualizing your programming, is trying to understand that we all want the same goals for a lot of our kids. The parents we know want to see them be able to succeed as best as they can. And our programming and the data and what we see in terms of how fast they learn and what they're capable of helps guide us as to how independent we're going to push to be into these much less structured environments. And I think that that's an important distinction to make, is that a circle time isn't always, the goal is not always acquisition of a new skill. It is largely a pro-social behavior. It's ability to learn and to take turns in a more natural context. And it gives you guys, the kids, a chance to sort of emulate and practice what they're most likely going to be able to be asked to do when they leave a setting like this. So that's been a big part of our process, again, is trying to sort of figure out, like, where's this kid going? What type of classroom would we see him discharge to? Is this or her? Is this child going to discharge to a regular classroom with some additional supports and maybe some small group around academic? Is this child going to discharge to a special classroom and need, pretty good IEP in order to be able to maintain learning? And if the child we think is going to need to be discharged into something like a self-contained classroom, we would really advocate and push that it's not time to discharge yet, because we don't want kids discharging from a place like this without being ready to be in a pretty minimally intrusive environment in school. And that combination becomes part of the parents, the educators, and our discussion of what's appropriate for the student. And of course, we always have our opinions, but we need to be able to remember that we are part of bigger systems, and that we can't always go into schools or have this expectation that schools will be able to do and implement all the strategies we think a kid needs.
Right.
So it's kind of our job to get them somewhere in between. This is what we think this kid needs. How do we start to program to take out and thin the schedule of reinforcement so that they don't need a reinforcer or a token after every 2 to 3 tasks in order to make it through without getting upset? But again, the kid's behavior is what guides us on that. If they can't be successful without a dense schedule of reinforcement. The schedule of reinforcement stays dense with a goal to thin. But I can't guarantee any one individual that will be able to sort of get to that thin schedule. That's a combination of biology and our learning history.
And that's great that you all look at that, because a lot of times people are so focused in on, like you were talking about earlier, the ABLES or the VB-MAP, whatever things are listed here. And even though there's like the barriers assessment in the VB-MAP, a lot of people don't attend to what are just kind of the environmental things that need to be tweaked and modified to get to be successful and be as independent as possible. Do you all have set, whether it's an assessment or things that you look at when you're kind of deciding how to balance that, how much is this person going to have just more DTT and less of the loose teaching versus more loose teaching and less DTT? Do you have kind of a formula you use for that, or
Not really.
no?
Again, it's sort of, I don't think there's like a pre-done assessment that we've developed or anything. I would say that it's a combination of looking at where they're falling on these types of assessments initially, and then it largely becomes more the process of after we get through those initial kind of ready to learn things that pretty much everybody needs to work on.
Yep.
Being able to keep your hands down when I put materials on the table, being able to make eye contact, being able to listen, having some conditional discrimination. These are types of elementary ready to learn programs.
Yep.
Once we get those kind of taught, because most of the kids do very well with those types of programs, it helps us then at that point say, all right, now we can introduce you to some more kind of difficult concepts or some pre-academic type of skills, with the goal with the pre-academic often being more trying to figure out if you can learn or how quickly you can learn than necessarily like the mastery of a pre-academic target, because really that's kind of not what we're supposed to be doing in the sense of just teaching academic targets. Of course, there's a caveat there. If I don't put a kid into academic target type of instruction, we go back to that same question: what's your discharge environment? If your discharge environment is school that's going to have a bunch of teaching and a lot of instruction, how can I possibly run an ABA program that will generalize into the natural environment if I'm not emulating that natural environment? So I think that it's more of kind of the process as we see what kids learn and how much they acquire and how quickly they learn. And then I think that there's also that part of, some kids are just more affected by this disorder than others. And I don't really like using terms to define that, but we can clearly, I think, agree that the complexity of the behavioral repertoire, the ability to make very, very, precise conditional discriminations is going to correlate with the ability to be more successful in looser environments, whereas our kiddos who need, they transfer stimulus control from prompt levels to what we naturally want to evoke that behavior very slowly. They often require most to least prompting hierarchies with very slow fades, typically needing 2 to 3 responses at a given prompt level before moving down a prompt level. Those kids are on a different track. And that was always the thing that I sort of worried about when I did all of my practicum and I did all my learning, and then being involved as a practicum director at one point in an ABA program, was my concern was that if you're not considering those factors, then your programming might be kind of coming more from just what I want the kid to do than where the child might be capable. Keeping in mind, again, like we never want to just give up and say, well, this kid doesn't know how to do that and therefore we can't teach them. But I do think that it's important for behavior analysts, and particularly those involved in early intervention, to remember that these are individual kids that we're working with, and that they do have differences in what their abilities are going to be, just as typical kids have differences in measures of things that not all behavior analysts love, but things like IQ and capability. I'm never going to be a physicist. Not going to happen. Not good at physics. Don't understand it. I don't think that I would do well with it. That's something that's kind of a limitation because I'm terrible at math and formulas. Could somebody teach me to do it? Possibly. I mean, I might be able to learn that. My motivation's not going to be there. So that combination of knowing where that motivation is and what motivates somebody, and designing a curriculum that's going to allow them to proceed in their skill levels, has been something very important to me, and what we've tried to sort of emulate in this environment.
Awesome. Do you want to know?
I love this conversation.
But you were talking about practicum and all that. Like, how did you get into behavior analysis? What's your backstory?
Yeah, okay, good question.
You were studying physics, it was too hard.
In my undergrad, giving away dates, but so back in around 2002, during my undergrad studies, I was majoring in psychology, and I had this class with Dr. Titus in Orlando. I went to University of Central Florida, and this class was a kind of introduction to behaviorism class, and I just remember sitting through this class and going, oh, this stuff is so boring. This is the worst. Just not digging it. Lo and behold, I ended up getting involved a little bit more with volunteering with CP Kids, which is an organization that works with kids with all sorts of developmental and intellectual disabilities. And I was very intrigued when I met the kids that were diagnosed with autism spectrum disorders, because they were just very different. Mm-hmm. And I was just interested in what they were doing and trying to understand why they were doing it. I had a heavy focus in like neuroscience at that time, so I was very trying to learn about like brain differences. And as I volunteered and worked with them a little bit more, I started to really enjoy working with the kids. It became fun, and I started to learn a little bit of therapy techniques, and that sort of led me towards getting more information about ABA, because ABA had sort of been thrown around a lot as one of the types of effective treatments for kids that were on the spectrum. So around that time I had met Dr. Jose Martinez-Diaz, who was largely my sort of person who introduced me to behavior analysis, and anybody that's ever met him knows he's got a wonderfully kind of infectious laugh and a great personality. So he drew me into the ABA camp, and as I started to learn from him, I just, after taking some courses with Jose back in the days when you could become a BC ABA and get your certification without having to go through a university approved curriculum, he sold me on it. He perked my interest. Started to work at a place called Quest Kids, which is another facility.
Another Quest person.
That's right. And so Dr. Ed Blakely was largely kind of my practicum director or my practicum supervisor. And so working with him, working with Quest, getting introduced to early intervention, I mean, it was just, to me, it was just magical. It all came together. I was craving so desperately something that made sense, was logical, and had more of kind of a process about it, and with the goal being sort of control and change of behavior. And it just mesmerized me. I was so amazed that some of the tactics I was taught to use actually produced change, and we could see it. We could see it with the kid, and we could see it in our data. And that's what sold me. And ever since then, went to FIT, finished my master's in applied behavior analysis with Jose and some other wonderful professors, including Matt Normand and several others, and never looked back. Been doing ABA. And
were you at Quest when Kendra was there? And I think was Kendra and Kim there? Or just Kim? Barron's? Was she there?
I think so.
Sounds like
it
you
may
would have
have
been there around the same time.
Right after, around when I left, because I left in about 2005.
Okay.
So I'm not
that
sure
might have been when she was coming on. What about Steve Ward? Do you know Steve Ward? I always ask Florida peeps.
It's not right.
No, he's one of my favorite BCBAs.
It's been a while. I left in 2005.
Yeah, so he's been down there. So he lived, I can't remember, was Carbone in the Orlando area?
He did a lot of our guest lecture in our elective classes. We're often with Vince Carbone, Pat McGreevy. Those guys were really good inspirations for learning about verbal behavior and learning how to implement BB strategies.